So, you know, seeing how the news shapes our views is part of why we're here tonight talking about hormone controversies. Because really, there is no controversy about hormones. We have very clear understanding of what part of hormones are dangerous and what part of hormones are safe, and how to make utilization of hormones safe for you and without risk, without any increased risk. Do women get breast cancer? Oh yes. 1 in 7, 1 in 8 women will get breast cancer. Is it because she's on estrogen? No. Toxins in the environment, excess body fat, poor diet, no exercise, all of those things, those are the reasons that feed into it. And so, you know, something like that happens very frequently. The question is, does the hormone cause it? That's the issue, not whether it happens or not. And so we're going to talk tonight about some of the other confusions that people have about hormones and, you know, where they come from. So what we're going to do is I'm going to tell you some about hormones, and some of you have already found your hormone truth or myth quiz that's in your folder. We'll be doing that later. And having a little like truth or myth. We'll go truth or myth. And this says myth versus reality, but it's really myth versus truth. So I want to tell you a little bit about what hormones are, because that's fundamental to understanding why we talk about them. The only way to get information from one part of your body to another is to send a messenger. And this was the messenger that ran the first marathon to, you know, to tell the troops what was going on. He was a messenger. We have messengers all over our body. So how does a gland in our brain tell our thyroid to make more thyroid hormone? How does a gland in our brain tell our adrenal glands to make hormones? And how does our thyroid gland tell every cell in our body to speed up metabolism? With messengers, and the messengers are the hormones. So there are many different types of hormones. We're going to talk particularly about a few hormones tonight, the ones that are controversial. I don't think anybody has a big controversy about thyroid. You know, we all know we need it, and there hasn't been all this stuff in the media about it. But I want to talk about the ones that bring up questions and doubt in your mind. So hormones also function. Am I standing in front of the screen for people? Can you see better now? Hormones also function as our thermostat and metabolism regulator. So that would be a lot thyroid. Also insulin, the hormone, controls metabolism of sugar. Hormones regulate aging, and this is the most important thing. And starting with when we're about 25, when we're hormonally at our optimal, begins the downward trend. So by the time we're in our mid-40s, one of the most important energy and vitality hormones, DHEA, is about half of what it was when we were 25. By the time you're 60, it's a quarter. So a lot of the things that are felt to be changes due to age, you know, what do you expect at your age, are really hormonal declines. And this is the other thing, you know, people say, well, we don't have like 20 or 30 year studies. Well, really, it's just been in the last 20 or 25 years that we've really started utilizing hormones for maintenance of health, slowing down the aging process, and aging what I call successfully, having healthy longevity. This is a new thing. You know, in 1900, the expected lifespan was about 45 to 50 years old. Nobody ever lived in the latter part of their lives. No, women didn't live in menopause. Men didn't live during a time of their life when their testosterone levels went down. And when people say, well, I think we should just let nature take its course, well, you know, before insulin, diabetics used to let nature take its course, and it didn't have a very good outcome for them. Diabetes is basically a disease of premature aging. The sugar ages your blood vessels, ages your brain. Diabetics have accelerated heart attacks and strokes at a much younger age than the general population, and they have a much higher rate of Alzheimer's disease. So that's an example of accelerated aging. So if we can slow down the aging process, we will age more healthfully. We've done a whole lot to expand our lifespan, right? So it went from age 45 or 50 in 1900 to here we are 200 years later, no, 114 years later. I'm not good at subtracting. And we've added another 30 years. But we haven't improved the quality of the last part of those years at all. And that's come from academic centers that have looked at it. So people are living longer, but not better. So the real question is, how can we live better? And really, the baby boom generation is the first generation to have the opportunity to do something about their aging, because it's only, like I said, in the last 25 years that we have an understanding of why we decline as we get older. And with that knowledge, you can do something about it. A large part of it is hormones. There are other things. There's oxidation, rusting from the inside out. It's diet dependent and exercise dependent. There are a whole lot of different processes. Sugar abnormalities, like with diabetes. You don't have to be a diabetic to undergo adverse effects from too much sugar. Don't wait till they call you a diabetic to control your sugar. Even if your sugar is elevated but not diabetic, you have a higher risk of dementia. So we have this understanding about the aging process, and that's allowed us to develop programs and supplements and approaches to slowing down that process and decreasing our risk of serious chronic illness. We know that all chronic illnesses, and what do I mean by chronic illnesses? Cancer, heart disease, including strokes, Alzheimer's disease, Parkinson's disease, those are all chronic illnesses, and they are all caused by inflammation. And what modulates inflammation? What you eat, your exercise, your mental, emotional, spiritual part of you, and your hormones. So all of those things modulate inflammation, and you want to be on an anti-inflammatory path in everything you do. So that's what we're about, and tonight we're going to talk about the hormone part of things. So hormones do regulate aging. Our wrinkling, sagging skin comes from diminished estrogen levels and growth hormone levels. Our loss of muscle comes from diminishing testosterone levels. Dementia, we have great evidence that estrogen and testosterone in men and in women and in men decreases risk of Alzheimer's disease and dementia. Depression is very much hormonal in men as well as women, and has other causes as well. It's a really complex one. And cardiovascular disease can be looked at as a hormonal disease. Hormones like testosterone and estrogen help to keep the linings of your blood vessels in healthy condition. The linings of your arteries is where cardiovascular disease starts. That's where plaque starts. And you want that lining kept velvety and soft and supple. You don't want it stiff and hard like a pipe with calcium deposits. Hormones help to keep it like that. So hormones definitely regulate our aging, not to mention symptoms, low libido, mood, energy, a whole variety of things that we're aware of. There's a lot that goes on that we're not aware of, but there's a lot that we know about it, that we don't, in ways that we don't feel well, that is hormone related. So when we have somebody on a hormone restoration program here, we use a number of different products, 8 of them. We're going to talk about testosterone, progesterone, and estrogen, because like I said, that's where the controversy is. The other hormones that we use, pregnenolone, which is a hormone that converts into a lot of these other hormones, but it also acts as a neurotransmitter in the memory center of your brain. So some of that diminishing of cognitive ability, of thinking ability as we age, oh well, it's just your age, is diminishing pregnenolone levels. something that can be restored. Thyroid is a whole other topic, but huge numbers of people have low functioning thyroid that contributes to weight problems, energy problems, mood problems, thinking problems. DHEA I talked about is this tremendous energy and vitality hormone. Melatonin levels diminish as we age, and so people tend to have more sleep difficulties as they get older, and sleep is absolutely foundational to your good health. And vitamin D I talked about, which functions more like a hormone, and like thyroid, there is a receptor or a spot on every cell in your body for it to have an action. So a receptor is like a lock, and vitamin D is the key, or thyroid is the key that goes into the lock, turns the lock, and causes something to happen inside the cell. So vitamin D is everywhere in your body, thyroid's everywhere in your body, and some of the other hormones are more targeted. They're not everywhere. They don't have actions everywhere. So we're going to talk about these three because that's where the big controversy is. Like I mentioned, hormones decline as we age. We're at our best at about age 25 to 30. You know, that's when people are too young to know how good they have it, right? Decline in midlife and continue declining. And then, of course, women have this really abrupt change when they go through menopause and lose a bunch of hormones, like all of a sudden, which is a very tumultuous thing to have happen for many women. So menopause, the average age is age 51. And there is this period that we call perimenopause, which when I got started in OBGYN, 30-some years ago, there wasn't even a term. That didn't exist, perimenopause. And it's traditionally said to last 2 to 5 years, but quite honestly, the changes start happening to women in about their mid-30s. So women in their mid-30s, their periods start changing, things start changing. It gets more and more apparent in the 40s, but it's probably more like a 15-year lead up. In men, testosterone declines little bit by little bit every year. The young men growing up now are particularly have a problem. Sperm counts are going down worldwide. Toxins in the environment have hormonal actions in our body, but not in a good way. And we think one of the reasons why young men have lowered sperm counts is because of these what are called endocrine disruptors. They disrupt proper endocrine function. All the things that are in plastics, all the things that are in, the adhesive that's used to lay the carpet, the organic solvents that are in paint, all of that are doing horrible damage to us. So best thing is eliminate plastics from your life. And then as far as men go, looking at who's affected, because a lot of times people think it's only very old men who have low testosterone levels. This chart shows about 2 to 3% of men in their 20s even have low testosterone. 20 to 30% of men between 30 and 40, and more than 50% of men in their 60s and 70s have low testosterone. So it's very prevalent. So in men, there's this new term that was developed called andropause, because andro is the Greek name for the male hormones. Testosterone and some of the other male hormones are called androgens. So this was called andropause in men and menopause in women. And sometimes we call it manopause. So we're going to talk about menopause and manopause. It probably should be womanopause and manopause. But anyhow. So these are a list of things, a partial list, and it's in your handout of symptoms. Remember I talked about symptoms. There are things that go on that you're not aware of in your body, but then there are symptoms you are aware of. And I know I see a skewed part of the population because people that come to see me because they have a problem by and large. Occasionally people come because they want to maintain good health and they're feeling pretty good, but most people come because they're feeling terrible and have any number of these problems with energy, sex drive, moods. They're not sleeping well. not as strong, thinking not as clear, higher body fat. You know, what happens as you get older is, even if you don't gain weight, you get this shape shifting where you get more fat around the middle and your muscles start going away. So your body fat increases and your muscle mass decreases. And it is really, it's part of healthy longevity. You must exercise and maintain your muscle mass. Low muscle mass, there's a medical name for it, it's called sarcopenia. And people who are sarcopenic, who don't have enough muscle mass, have much higher mortality. So you will die earlier if you don't maintain your muscle mass. So people that, you know, elderly people that are kind of bird-like looking, you know, they're very tiny. For the most part, they have skin and they have bones. They may not have much fat, but they don't have muscle. And you need the muscle. And exercise performance, people notice, men a lot notice this. They can't do what they've been accustomed to doing as far as exercise on the racquetball court or playing tennis, you know, really active sports. They're not able to perform as well. And some women too, women that are more vigorous exercises will start seeing that they can't lift weights as heavy. It takes them longer to recover when they do exercise. A lot of this is hormonal. Some of it is nutrient deficiencies as well. So this is the reality of menopause. And it's pretty much the same thing for women in menopause. The risk of being in menopause with low testosterone is premature aging, higher incidence of heart attacks and strokes. I think you guys will be able to answer this quiz really well by the time we get there. Increased dementia if you have low testosterone. Higher body fat. Like I mentioned, testosterone helps you maintain your muscle. Your muscle is the tissue in your body that metabolizes the nutrients that you take in, the calories that you take in. Fat is not metabolically active. So if you lose muscle and gain fat, what you eat is going to get converted to fat rather than getting used sufficiently by your muscle. Is that clear? I think I didn't say it clearly. I'll say it again. Your muscle is your metabolically active tissue. So if you have lost muscle because you're not physically active, you can eat the same thing. You know, people say, I'm eating the same thing. I always eat the same amount, the same kind of foods for the last 3 years, and I keep gaining, because you're losing muscle that would be metabolizing those calories if you're not physically active. And more of those calories are going to go on your body and get stored as fat rather than getting used by your muscles for energy. What you eat either goes, some of it goes to your brain because your brain needs a lot of calories to function. But other than that, it either goes to your muscles to provide energy or it gets stored here. And men also have risks of bone thinning. So men with low testosterone get into problems with osteoporosis just like women do with their low estrogen. And menopause risks are essentially the same. You'll age more quickly. We know that women before menopause have a relatively low amount of cardiovascular disease, and shortly after menopause, we catch up with men. We have as many heart attacks shortly after we turn menopausal. There's something about estrogen that's protective. Estrogen is important in terms of people for a long time. It's not so much anymore, but people used to say, I'm worried about being on estrogen because I'm afraid it's going to make me fat, because they think about the chickens that are, goosed up with hormones to make them fat. And in fact, estrogen helps you keep from laying on this mid-abdomen fat. And estrogen also, very importantly, helps make you more resilient to stress. So all the changes that go on when you become stressed that make you store more fat are mitigated by estrogen, which keeps you from suffering those physiologic effects of stress as severely. Estrogen is anti-inflammatory, like I said, in your arteries. So, you know, what are the options? Like I said, you can either let nature take its course, and, you know, we see that a lot where people are not maintaining and advocating and working on their own behalf. And we were just having a little conversation up here earlier about the conventional medical system and how they will just kind of let you go down the tubes. And I'm sure we've all had experiences. And I was sharing with Gretchen, I had an experience like that this year about my knee, which I happen to be a woman who tends to get torn ligaments in her knees. So I had my second torn ligament last year and got it repaired. And first of all, the doctor said, you know, we hardly ever do these in people over 40. Well, I was 67. He said, we hardly ever do these in people over 40. And I was like, really? Why? And he's like, well, they're just not that active. And I'm like, well, I need to get this fixed because I am not sitting around. And so he did a fabulous job. I had an incredible recovery. I went to physical therapy. Everything was just totally like smooth and as beautiful as it could be. I was happy. Everything healed well. I started working out with my workout class again, and I did it slowly. I didn't do anything crazy. I walked, and then I walked faster, and then we did lunges and squats and things like that to build the muscles up. And then I tried a little bit of jogging on the grass. You know, very soft surface, just a few jogs. And the next day, my knee was in excruciating pain. And I was like, wow, I don't know what I did. So I waited a couple of weeks. I thought it was just something weird. So I tried it again. I tried stairs, and the next day I had excruciating pain. And so I went back to the orthopedist, and I said, something's really wrong. Like, all I can do is walk slowly. Like, I can't exercise at all, and can you figure out what's happening? And he said, well, you know, at your age, osteoarthritis. And I said, well, I didn't have osteoarthritis 8 months ago when you did my surgery. I didn't have any pain then. I tore the ligament. He's like, well, you know, I don't know. We'll send you to physical therapy. And so I got to physical therapy. All due respect to Gretchen, is a physical therapist. And the physical therapist started telling me her story of her bad knees and her osteoarthritis. And I said, you know what? I need to see somebody else. I want to see somebody who's not going to write me off because of my age, who's going to do an evaluation. So I've lived it myself. And so I got somebody who I knew from the first knee surgery I had worked with. He didn't write me off because of my age. And so I said, I want to see Russ. Set me up with him. And he like looked at my knee and he really evaluated, and he's like, oh, your IT band is really tight and this is really tight and your kneecap is not riding properly on the joint. It's pulled over to the side, and that's what's giving you all the pain. So we need to really work on stretching. He did all this manual stretching, and I did stretches, and I'm running again. And I thought, you know, if I had listened to the orthopedist and the first physical therapist, I would have been mostly sitting around and taking a few walks and not exercising as vigorously as I like to. So I see firsthand what happens to me in the conventional medical system. And so we were just talking about, I mentioned that I'm writing a book called The Patient Revolution, Why Doctors Are Blind to the Solutions That Will Get You Well. Because I started thinking about, you know, why was I so resistant for so long to learning about alternative forms of medicine? What is it about doctors? What is it about our training? What is it about the whole medical system? What is it about pharmaceutical companies and hospitals and insurance companies that feed into this rigidity of thought that takes us to pharmaceuticals or surgery? And that's it. That's all we know how to do. And it takes a lot of times a personal experience to get doctors to look at alternative medicine, or somebody in their family where they go searching, looking for another solution and finding it. And so this whole view of aging is, well, what do you expect at your age? And there's not much of anything you can do about it. How many people are deteriorating more and more? And Gretchen was saying she does physical therapy at home with the geriatric population. They are just one thing after the other adds on to help them go down, down, down. Not the good food that they need, not the activity that they need, not the supplements they need. I mean, there was a study that showed very minimal doses of vitamin D in a nursing home population cut the risk of falls by 50%. Like, why would you not give that to everybody? Why don't all doctors know that? Why isn't everybody on vitamin D if they're in a nursing home or if they're elderly? You know, so that kind of thing just, you know, drives me crazy. You know, it's a low-cost intervention. Well, it's not going to make money for the insurance companies, and it's not going to make money for the pharmaceutical companies. It'll make a nutraceutical company some money. It's not going to drive the whole system.
Why do you think that people do have low levels of vitamin D, especially in California?
Yeah, why are vitamin D levels so low? A few reasons. One is people try not to get too much sun exposure because of melanoma concerns. And really about the only way you can get vitamin D is through conversion of sunlight in your skin. And as we get older, our conversion's not as good. So there are very few foods. There's, you know, vitamin D fortified milk, which I don't think is great. Some mushrooms have vitamin D, but not the kind of amounts that you really need to get. And it's amazing to me when I got into anti-aging medicine, being in Southern California and seeing how virtually everybody's vitamin D level is. I don't mean just like 30 or 20 something. I see people who at less than 7, 15, 12, such an increased risk for chronic disease. I'm like, I'm so happy when I see them and I know we're going to do something about it because I know that we're preventing some serious illnesses down the line. So the whole issue of, you know, how is aging viewed? So your regular doctor, when you talk about hormones, first of all, is going to think that hormones only mean those 3 hormones that I mentioned, the estrogen, testosterone, and progesterone. So that's what they think of with hormones. And if anything, they're going to think about relief of immediate symptoms like hot flashes in women. They have no knowledge of the overall health benefits, nor do they really believe that you can slow down the aging process. So without that belief, you are not even going to look for things that help people maintain good health, right? You have to believe it can happen. And I see it over and over again. Don't we all know people who didn't smoke, stayed physically active, eat well? Many of them live a really long, healthy time. They don't get sick. But if you're a doctor and you don't really believe that you can slow down or change the aging process, you're not interested in hormones. And with all the media hype that I talked to you about, you succumb to the same, you know, doubts about hormones and hormone safety and promote that to your patient. So that's one of the things I deal with, like the doctor today with the vitamin D. I'm dealing with that all the time with the estrogen, progesterone, testosterone. So like I said, there are many components to good health. Your health is like a 3-legged stool. Lifestyle, what you're eating, what your activity level is like, your sleep, your mental, emotional, and spiritual. And with that, I would also say community, because we know social interactions are very important to healthy longevity, are 2 of the legs. And then the 3rd leg is the physiologic and hormonal one. And that's a lot the area that I really delve into. So I want to tell you a few stories. I want to give you some examples of some of the things that we end up dealing with here in patients who come here, so you have an idea of what we do and how it goes. So low libido is a very common problem I see. And as I have special expertise and training in women's sexual function, and of course, by virtue of getting involved in that, men's sexual function. I was active for quite a while in the International Society for the Study of Women's Sexual Health, which is a wonderful organization that brings together psychologists, psychiatrists, gynecologists, endocrinologists, researchers who research on rats. So we had like these people talking about their rat studies, and then we had other people talking about women sniffing t-shirts with men's sweat on it, and you know, it was really eclectic. It was great. So I know that especially for women, their sexual function and libido is very complex. It really depends on a lot of factors: self-esteem, mood, the relationship, but also hormonal. And early on in my practice, I met a really lovely woman named Maureen. She actually had come to be in a clinical trial that I was running, and she didn't qualify for the clinical trial. And I said, well, you know, the bad news is you don't qualify for the clinical trial, but the good news is since you don't, if you'd like to be a patient here and start working on some of these issues, we can do that. And she said, great. She was in her 50s. She had recently gotten remarried. She said, my libido's horrible. I feel dead down there. If I never had sex again, it would be okay with me, but it's not okay with my husband. And besides, I just got married. So we did testing. We did restoration with estrogen and testosterone, because estrogen's important for sexual drive in women, and testosterone and the other hormones. And her interest in sex returned. She developed a nice sexual relationship with her current husband, and she said to me really wistfully, she said, you know, if I had known about this years ago, my first marriage would have never ended. So I was like, whoa, the power of hormones. And then mood disorders are a major problem that we see here, depression and anxiety. And a patient came to see me a couple of years ago. She was 48 years old. She was brought in by her very concerned husband. She was so depressed, she made no eye contact with me. And she kind of sat huddled in a corner, barely said anything to me. And she had previously been this high-level executive in human resources, done volunteering, loved to cook at home, you know, had a vibrant life, very active, and now she hadn't worked for 2 years. She didn't cook anymore at home. Her kids were kind of like fending for themselves. Her husband was trying to like keep it all together. And her goal for her treatment was to be able to at least get back to work part-time and maybe start doing some charity work again. And we did testing and started her on bioidentical hormones. And shortly after I started treating her, she became so depressed the husband had to take her in to get admitted to the hospital. I kept saying, you need a psychiatrist. I'm not a psychiatrist. And she wouldn't, she was absolutely resistant to seeing a psychiatrist and ended up getting admitted. Well, then she got a psychiatrist. And they put her on, they diagnosed her as being bipolar and put her on just a touch of medication, because with the bioidentical hormones and the things that we were doing to balance her neurotransmitters, she became balanced and functional very quickly in a matter of a few months, which any of you that know about bipolar disorder, it's usually months or even years until people's meds get balanced and they become functional. And she really got functional like in a matter of a few months, and the first thing she did was cook dinner for the family. That was a big like landmark. And you know, by the end of 8 months, she had a part-time job. She was back to volunteering, and she really she felt like a new person. She looked like a totally different person. She looked me in the eye. She engaged. So that was a somewhat unusual problem. Most of the people I see have depression, not bipolar disorder with manic depression. But she made a really quick turnaround, and talking to her psychiatrist, we both discussed the fact that getting her hormones and all these other brain chemicals balanced really facilitated her recovery. Anyhow, the last story I want to tell you about has to do with fatigue. Harold, who's a 51-year-old gentleman, came to see me, and he was really overweight, diabetic, was really concerned about his cardiovascular health. He had stopped exercising, stopped riding his motorcycle because he was so fatigued, stopped playing tennis. And the thing that really propelled him to come here was that he had a girlfriend who was 30 years old, 20 years younger than he was, who was pregnant and going to have a baby in 2 months. And he said, how am I going to have the energy and the wherewithal to be a daddy to this new baby the way I feel? You know, I got to do something. And so we did testing. His testosterone level was really low, and I was anxious to work on his cardiovascular health and other things, but that's not what he wanted. He wanted his energy and his libido and his erectile function back. And so his thyroid was very underfunctioning. His DHEA level was very low. It was a quarter of what it should be. Even he was 50, he was on the really downward slope. And so he took my advice. He got started on a program to get his hormones replenished. And actually within a month, he said, wow, I'm feeling so much better. And so he was really relieved because he could see like the baby was on the way and he was doing better. So that's our fatigue story. Anyhow, we talked about sources of medical information. When the Women's Health Initiative came out in 2002, when the results of it broke, we doctors were not informed. That was the study that showed that women had, you know, a greatly increased risk of breast cancer on Premarin and that synthetic progesterone Provera. And here's how it came down. This was in July of 2002, July 9th, 2002. It was a Sunday night. They called a press conference and gave out the results, the preliminary results. It was supposed to be an 8-year study. They stopped it after 3 years because they had a much higher rate of breast cancer in the women using Premarin with Provera. And they held a press conference, so it got blasted out across the airwaves and in the newspapers. And I came to work on Monday morning and didn't know what hit. It wasn't put out in a medical journal. We weren't given advanced information. I'm scrambling to find out what study, like, you know, what were the results, what were the statistics. And so that was a really incredible example. It was the National Institutes of Health, and I had the opportunity at a women's medical conference to ask the director of the Women's Health Initiative from the NIH whether she would do that again. I said, you have no idea what it created. It created pandemonium. Women went off their hormones wholesale. I never had the opportunity to talk to people. They just got scared and went off. And it's actually estimated that in the first 10 years after that result came out and women went off their hormones, there was anywhere from an excess 20,000 to 90,000 excess deaths in women aged 50 to 59 due to cardiovascular disease because they were not on their hormones. Nobody thought about that.
I wonder what the divorce rate was.
It was horrible. You know, and I had, like I said, all patients didn't contact me. So I saw some people like for their annual exam a year later and they'd be like, oh, I haven't slept in a year. These hot flashes are horrible. I went off my hormones. Let me tell you, sleep deprivation is not good for healthy longevity. It will shorten your life and cause premature aging. So things that everybody makes fun of, you know, the hot flash, oh, there she goes again, you know, get the fan, really has serious health implications. It's not just an inconvenience. So I had a particular bone to pick about how the Women's Health Initiative results came out. It did not come out in a professional way. And it put the country in pandemonium, and women couldn't find out fast enough from the limited number of people who could give them information what to do, and they went off their hormones. Big Pharma, the pills in here are little dollar signs. They are really trying to close down compounding pharmacies. The makers of Premarin have been on a warpath for the last 15 years to close down compounding pharmacies, trying to get legislation in place, not wanting people to have the ability to choose what they want to do. So Big Pharma plays a very big role in this whole issue of hormones. You asked about low T centers and low T. Everybody wants to cash in, right? So the pharmaceutical companies, Rob and I just looked at something. You found a very nice website online talking about the effects of low T. And I said, Rob, this is like really slick. Let's look up who these AbbVie people are. And sure enough, it was the manufacturers of Androgel, which is one of the commercial androgen testosterone preparations. So you've got like the pharmaceutical companies fomenting the low T. You've got this low T clinic, which as far as I could tell, maybe there are physicians involved, but mainly it's physician assistants and nurse practitioners that staff those clinics. And they have a formula. You come in, you get it done, you know, really fast, and you're back out. And they said, oh, here it is. At Low T Center, your testosterone replacement therapy is performed in a comfortable, casual atmosphere, not a stuffy doctor's office. We can usually get you in and out quickly. Anyhow, I think being in a stuffy doctor's office, if it's a doctor that looks at your overall health, is a good thing. Okay, oh, then who else do we have in the mix? We have the lawyers. So I told you there were a couple of studies on testosterone that came out earlier this year. And one of them was from the VA Medical Center. It was published in the Journal of the American Medical Association, what we called JAMA, J-A-M-A. And it had men who were on testosterone. They did not measure their levels. They didn't follow them up with levels or really any blood tests. They just gave them testosterone. I used to work at the Veterans Hospital. I can tell you that is a very ill population. And so they gave these really ill guys testosterone, and some, the older age group had higher incidence of heart attacks. It turns out that, and there was another study that showed older men had a higher incidence of heart attacks. One of the studies was published in JAMA, and a group of knowledgeable doctors, some of them anti-aging doctors, got together and really delved into the statistics and found that the statistics were so poorly done it actually showed the opposite, that it cut down on heart attacks, forced JAMA's editors to retract the article. That never happens. I can tell you that never happens, that medical journals retract articles. That article got retracted. Well, who knew that? Was that splashed all over the front pages? No. So who gets in the mix? The lawyers. Low T complication? Give us a call. Testosterone therapy heart attacks? Give us a call. Contact us today. So you've got the lawyers, they're all over the internet. So of course you get scared. Oh my God, my testosterone is going to give me a heart attack. Is it any wonder that people are confused? Female hormones are only for reproduction. Myth or truth? Myth. Very good. We talked a lot about this. You don't have any questions about that, do you? Okay. Low testosterone is only a problem for old men. Myth or truth?
Myth.
Myth. Okay. Any questions about that? You saw the graph. Hormones should only be used in menopause for relief of hot flashes. They should be used at the lowest dose for the shortest time. Myth? Truth. Myth. Yeah, estrogen has over 400 functions in the body. It does help with hot flashes and night sweats, but it does a lot more than that, and we talked about that. It helps to maintain muscle, enhance sleep, improve mood. Only men need testosterone. Myth or truth? Myth. Testosterone, muscle building is important for women, libido. Women have an overall sense of well-being when their testosterone levels are adequate. This rather nondescript well-being, what does that mean? I don't know. They feel good. Let's see, myth versus truth. Estrogen is dangerous. It causes breast cancer. Okay, the wrong estrogen is dangerous, especially if it's paired with the wrong progesterone. And that was the Premarin and the Provera that was in the Women's Health Initiative. Definitely increased risk of breast cancer. Okay, so that was the first thing that came out, got blasted all over the place July 9, 2002. What then came out, I don't know how many years later, 4 years later? Oh, we reworked the data and looked at it, and the women who were only on Premarin, they didn't have any increased risk of breast cancer. That didn't get blasted all over the place. So it turns out it really wasn't the Premarin. It wasn't the estrogen. It was that progesterone. A product that causes like double to triple the rate of breast cancer. Why is it still on the market? Ask yourself that, the Provera. Why is that not off the market? It's a known carcinogen. Big pharma. Okay. Estrogen causes heart attacks and strokes. Myth or truth? Okay, the wrong estrogen causes heart attacks and strokes. Premarin was given as a pill. You had asked about oral testosterone. Well, oral estrogen for women ends up causing increased blood clotting. It thickens your blood. And so what the Women's Health Initiative did, the average age of the women that were enrolled was age 67. So remember I said the usual age of menopause is 51. So they were 16 years into menopause. Remember what I said about once you hit menopause for women, your protection against cardiovascular disease really drops. So they were 16 years into menopause. They probably had a bunch of plaque. Now we're giving them a pill that thickens their blood, and yes, they had an increased risk of clots, venous thrombosis in their legs, heart attacks, and dementia, not Alzheimer's, dementia caused by mini strokes. So why is that estrogen still on the market? That's a question. Okay, testosterone is only involved in sexual function in men. Myth or truth? Myth. Okay, testosterone is dangerous. It causes prostate cancer. Myth or truth? Okay, this is where it gets a little muddy. Okay, what we do think is like what your oncologist said about breast cancer, is that if you have a prostate cancer, testosterone may help it grow. It does not actually cause it. But then there are all of these contradictions. Men with low T have more prostate cancer. Giving testosterone after prostate cancer treatment when things are stabilized does not increase recurrence. So it's a little hard to figure out, and there's some theories about either very high levels of testosterone or very low may be the problem, and in the middle is okay. It hasn't all been worked out. So I agree with, if someone's been, we just had a gentleman who got started on hormones who had a high PSA at his first visit, and I said, you need to get this checked, and he has an early prostate cancer. His doctor said, come off testosterone. I agree with that. But after a period of time, if his PSA goes down and stays down, I would feel comfortable reinstituting it. Okay, now the last myth, bioidentical is just a marketing term. Bioidentical hormones are the same as synthetic ones. Yeah, that's a myth. And I used to think that before I got into this field. I was like, oh, and I tell my patients that, oh, bioidentical hormones, it's just a marketing term. It's no different than the commercial product. There are some commercial products that are bioidentical. Prometrium is a progesterone that is a bioidentical natural progesterone. And there are some of the skin gels in women that are bioidentical estradiol, but they don't have a balance with the protective estrogen in them. The androgel in men, that's a bioidentical testosterone. So I don't necessarily knock that, but to say that they're the same as the synthetic ones, like the oral testosterone, that is not true. The risk breakdown is totally different. So let's see, any other things that I want to... Oh yeah, the Premarin-only users in the Women's Health Initiative actually had 20% reduced breast cancer risk. So they had less breast cancer on estrogen. 50% reduced Alzheimer's risk in estrogen users.